Good evening. I'm Kelly Gear-Ripken, National Chair of A Women's Journey. On behalf of Johns Hopkins Medicine's A Women's Journey, thank you for joining us this evening for our monthly webcast series, Conversations That Matter. A Women's Journey strives to improve your well-being through health education. Ordinarily, we discuss a disease or disorder. Tonight, however, we are pleased to talk about hypertension, a prevalent risk factor for other diseases. I am pleased to introduce our speaker, Dr. Yvonne Commodore-Mensah, Assistant Professor of Nursing, Johns Hopkins University School of Nursing, Joint Faculty Appointment, the Johns Hopkins University Bloomberg School of Public Health, the Center for Health Equity. Following our conversation, Dr. Commodore-Mensah will respond to many of your questions, so please use the Q&A on your screen to ask questions throughout the evening. Tonight's webcast will conclude at 8 p.m. And tomorrow you'll receive an email asking you to complete a brief survey about this webcast. In the coming days, the video of tonight's live streams will be available on the A Women's Journey website, hopkinsmedicine.org/awomensjourney, under Conversations That Matter. I want to take this opportunity to acknowledge and thank Johns Hopkins University's program, Hopkins at Home, for their production assistance. You can visit their website for additional lectures and courses throughout the year. And now I'm pleased to begin tonight's conversation with Dr. Yvonne Commodore-Mensah. Thank you.
Thank you so much, Kelly, for that warm introduction. And thank you to the organizers of A Woman's Journey for inviting me to talk about hypertension. And I also want to thank the audience for taking time to learn more about hypertension. The objectives for this presentation are as follows. I'll share some national statistics on hypertension. We'll talk about the causes of hypertension. I'll also present some information about current hypertension guidelines. And lastly, I'll talk about effective approaches to prevent and control hypertension. And I'm also hoping that by the end of this presentation, you'll feel empowered to make informed choices to prevent and manage your high blood pressure. So let's start by reviewing some key definitions. So blood pressure is the force of blood against the walls of your arteries. And blood pressure changes throughout the day and depending on your activity level. So physical activity, salt intake, caffeine, sleep, they all affect your blood pressure. But when your blood pressure stays high over time, it is termed high blood pressure. And the medical term for this is hypertension. So a blood pressure reading is given in millimeters of mercury, and there are two numbers. So the top number is your systolic blood pressure. So that's the pressure in your arteries when your heart beats. And the second number, or the lower number, is your diastolic blood pressure. So that's the pressure in your arteries in between beats. One of the dangers of hypertension is that it's a silent killer. So as shown on the cover of the Time magazine in December of 2004, hypertension is still a stealth killer, and you can have it for years without knowing it. So although hypertension has no symptoms, you may experience symptoms if your blood pressure is severely elevated. So you may experience headaches, chest pain, vision problems if your blood pressure is extremely high. So why do we even care about hypertension? Well, the former Surgeon General issued a call to control hypertension in October of 2020, making hypertension control a national priority. So hypertension is one of the strongest risk factors for stroke, for heart attack, or kidney disease. And some studies have shown that hypertension in midlife is actually a key risk factor for developing vascular dementia later on in life. And there's also mixed evidence about the relationship between hypertension and COVID-19 outcomes. But some studies have shown that Among patients who are hospitalized with COVID-19, they are more likely to have hypertension than those who are not hospitalized. Hypertension clinical guidelines are used to define the cutoffs for diagnosing hypertension as well as treating hypertension. So the blood pressure categories are decided based on well-designed studies and are often redefined when we have more data or more evidence. So if your systolic blood pressure or your top number is less than 120 and your diastolic blood pressure is less than 80, your blood pressure is normal. But according to the 2003 guidelines, if your systolic blood pressure was 130 or your diastolic blood pressure was 80 or more, or on 2 or more occasions, you'd be considered as having what? Pre-hypertension. But according to the current 2017 guidelines, you would be diagnosed with stage 1 hypertension. One unique aspect of the 2017 guidelines is that treatment for hypertension is not only based on your blood pressure, but also your risk for heart disease. So if you have a family history of heart disease, if you have other cardiovascular disease risk factors, that may influence your provider's decision to prescribe hypertension medications. So what are some of the risk factors for developing hypertension? They include a family history of hypertension, also older age. And if you're physically inactive, if you have a poor diet, if you're overweight or obese, and also drink too much alcohol, these are all risk factors for developing hypertension. So how common is hypertension? Well, if we use the 2017 guidelines, 1 in 2 Americans can be considered as having hypertension. So that's about 47.3 million of US adults and over 121 million Americans who have hypertension or high blood pressure. So we also know that there are sex differences and racial and ethnic differences in the prevalence of hypertension. So among males, Blacks have the highest prevalence of hypertension, and among females, Blacks also have the highest prevalence of hypertension at about 58%. We also know that hypertension prevalence also differs based on geography. So we know that southern states have some of the highest prevalence of hypertension. Southern states also have the highest prevalence of overweight or obesity. And consequently, they also have the highest prevalence of stroke, which I mentioned is a major consequence of uncontrolled hypertension. One concerning finding from national data is that hypertension control in the US is worsening despite the availability of effective and affordable medications to treat hypertension. If we define hypertension as 140/90, only 54% of adults in 2013 had their blood pressure controlled. However, between 2017 and 2018, that number dropped from almost 54% to 44%. So what happens if we use the cutoff of 130/80? The shocking statistic is that only 1 in 5 have controlled blood pressure. And so this makes it a major public health challenge to improve blood pressure control. In case you're wondering why are blood pressure control rates so poor, well, there are a number of factors. It's not just one thing. There are health system factors such as practice resources, staffing that contribute to the poor rates of blood pressure control. We also know that there are provider level factors. So competing priorities, communication skills also contribute to the poor control rates of blood pressure. We also know that patients also struggle with managing their blood pressure if they don't adhere to lifestyle changes. And they may also have challenges with taking their medications as prescribed. And lastly, we also know that conditions in our society, right? So conditions in our home environment, our work environment, and what we often call social determinants of health also affect our ability to stay healthy. So I led a recent study along with some colleagues at Johns Hopkins to understand the relationships between social determinants and hypertension outcomes. So we looked at national data from the NHANES, the National Health and Nutrition Examination Survey, among over 20,000 adults, and 51% were females. We found that being Black, not having a routine place for healthcare, not having health insurance were all factors that were associated with a lower likelihood of having blood pressure control. And among women, particularly, we found that those who were employed versus unemployed had worse blood pressure control rates, and those who were married versus unmarried had worse blood pressure control rates. Now let's focus our attention a little more on what we know about hypertension in women. National data suggests that although we've done a decent job of increasing awareness, treatment rates, and to a lesser extent, blood pressure control rates, improvement is actually lagging among Black women. And so there's also data that suggests that chronic hypertension, right, that's defined as systolic blood pressure greater than or equal to 140 or diastolic blood pressure greater than or equal to 90, either during pregnancy or less than or equal to 20 weeks during pregnancy, increased 13-fold between 1970 and 2010. And Black women had a higher rate compared to white women over the 40-year period. Like I said, although hypertension awareness has improved, one of the most concerning findings is that young women between the ages of 18 and 44 are less likely to be aware that they have hypertension compared to older women. So the US Department of Health and Human Services commemorated National Women's Blood Pressure Awareness Week in October of 2020. Well, if you ask me, every week is a good week to encourage women to maintain a healthy blood pressure and improve their overall health. So why should we focus on hypertension in women? We know that in the US, every minute, a woman dies of a heart attack, stroke, or another form of cardiovascular disease, and hypertension is one of the leading risk factors. We also know that 9 out of 10 women have at least one of those risk factors. We also know that heart disease and stroke caused more than 1 in 3 pregnancy-related deaths from 2011 to 2015. Uncontrolled hypertension can also affect a mother and an unborn baby. In the mother, it may lead to a stroke, and in the baby, it may lead to a preterm birth if blood pressure is not controlled during pregnancy. And we also know that although women who are older than 55 years of age have a higher risk for high blood pressure, recent studies have shown that there's an increase in the number of young women who have heart disease. Many of you may be familiar with the American Heart Association's Life Simple 7 metric, and this is a metric to encourage all Americans to achieve ideal cardiovascular health. And controlling blood pressure is one of the important components of this American Heart Association Life Simple 7 metric. The other factors are abstaining from smoking, being physically active, maintaining a healthy weight, consuming a heart-healthy diet, maintaining normal blood glucose and cholesterol levels. So how do we treat hypertension? Well, hypertension is treated with a combination of lifestyle changes and blood pressure medications. So in terms of lifestyle changes, a healthy diet, being physically active, maintaining a healthy weight, and managing stress levels are all strategies to treat hypertension, and we'll talk more about these interventions in the subsequent slides. Now, in terms of medications, there are different types of medications that work in different ways to lower your blood pressure. Some of these medications help to relax your blood vessels, your arteries. Some of them help to remove extra fluid. So the water pills or Lasix, that's how it works. And some of them also allow your heart to beat more effectively in order to lower your blood pressure. So over the next 2 slides, I hope to convince you that lifestyle changes do in fact work. So if you were to achieve an ideal healthy or ideal body weight, you could potentially lower your systolic blood pressure by as much as 5 points. If you're able to change your diet and adhere to what we call the DASH diet, so it stands for Dietary Approaches to Stop Hypertension. So this is a diet that consists of a diet rich in fruits and vegetables, but low in unsaturated and total fats. You could potentially lower your systolic blood pressure by as much as 11 points. If you reduced your intake of dietary sodium, you could also reduce your systolic blood pressure by as much as 5 or 6 points. And if you increased your intake of potassium, you could also lower your systolic blood pressure by as much as 4 or 5 points. Some of you may have heard the expression, exercise indeed is medicine, and that's true. And exercise is a drug-free approach to lowering blood pressure. And so one of the only side effects is that you may actually enjoy it when the endorphins kick in. So endorphins are the chemicals released by your body when you exercise, and they help to relieve stress and reduce pain. So regular physical activity makes your heart stronger. And depending on the amount or the type of physical activity that you engage in, you could reduce your systolic blood pressure by a range of 4 to 8 points. And if you also reduce your alcohol intake, if you're a woman, you shouldn't consume more than 1 drink a day. And if you're a man, you should consume no more than 2 drinks a day. You could lower your systolic blood pressure by as much as 4 points. And so at this point, we'll go through a couple of myths and facts. I'll share some information with you, and I'm hoping that you'll correctly identify them as myths or facts. So the first is that hypertension cannot be prevented. I'm going to imagine that all of you answer that this is a myth, right? And so even if you have risk factors for hypertension, such as a family history, there are things that you can do to prevent hypertension, and they include maintaining a healthy body weight and also being physically active. Here's another statement. No symptoms equals no problems. Well, if you said this is a myth, again, you are correct. Even if you feel fine and don't notice any symptoms, you could still have hypertension. And as we said earlier, hypertension indeed is a silent killer and can damage your heart. It can damage your brain and also damage your kidneys. And here's the last one. Table salt is the only source of sodium. If you said this is a myth, then you're, again, correct. So there are different sources of dietary sodium, including canned foods, soups, soda, and this often surprises a lot of people. So it's important to read your food labels, because there may be a very high sodium content in foods that you often consume, and you may not even know this. So it's important for you to work with your physician or other healthcare provider to determine the right combination of lifestyle changes and medications that will help to control your blood pressure. So on this slide, I just shared a couple of things that you can do at home to help you control your blood pressure. And one of the first is checking your blood pressure at home. Home blood pressure monitors can be found online and be purchased online, and some of them are under $20. And if you invest in a blood pressure device, it'll help you to know what your regular blood pressure levels are, so you can communicate this with your provider. And if you're prescribed medications, also consider purchasing a pill box to help you organize your medications and take them as prescribed. And also ensure that you consume heart healthy foods and foods that are consistent with a DASH diet that I referred to earlier. And if you do drink, do try to limit your intake of alcohol. And the last thing I want to point out on this slide is that a healthy plate leads to a healthy weight, right? So be cognizant of what you consume and make sure that your diet is consistent with the dietary approaches to stop hypertension. As women, we often spend a lot of time with people in our network. And this picture makes me very happy every time I see it, because it shows two people who are really enjoying engaging in physical activity. So exercise is a very important intervention to prevent and control hypertension. Also, like I said earlier, make sure that you watch your weight, and it's almost impossible to eliminate stress, especially now during the pandemic, but try to reduce your stress levels as much as possible. And also make sure that you see your healthcare provider, right? Like I said, because hypertension is a silent killer, it's important to see your provider often so that your blood pressure can be monitored and treatment prescribed if your blood pressure is elevated. And also take advantage of your support system. If you belong to a book club or you belong to a church community, take advantage of this network to work with others to help prevent and manage your hypertension. Another challenge is that for patients who are prescribed medications, a lot of patients struggle with taking their medications as prescribed. And only about 51% of Americans who are being treated for hypertension actually follow their provider's recommendations. And if you don't adhere to treatment therapy or take your medications as prescribed, you can increase your risk for stroke, heart attacks, or kidney damage, right? And so there are a number of tips that I want to share with you. If you need help remembering to take your medications, you can invest in a pill box, like I said earlier. There are mobile applications that also help you to remember to take your medicines. And lastly, try to create a routine. So because you brush your teeth every day, it would be helpful to make sure that you put your blood pressure medicines close to your toothbrush, right? So it's something that you always remember to do. Another thing I wanted to emphasize is home blood pressure monitoring. So home blood pressure monitoring is one of the ways that you can partner with your provider to improve your blood pressure. Some insurance companies actually provide free home blood pressure monitors. So please reach out to your insurance company to understand the options that are available to you. So when you do purchase a blood pressure device, make sure you measure your blood pressure at home regularly and check it several times a day and keep a log, right? There are also mobile health applications that help you to track your blood pressure. And if you can invest in a Bluetooth enabled blood pressure device, it will help you to sync your blood pressure readings with your smartphone so that you can easily share this information with your provider. One thing to remember is that all blood pressure devices are not created equal. So if you um, go to Amazon right now and you try to purchase a blood pressure device, you'll find thousands of devices and it may be overwhelming. One of the resources I want to share with you is this website called validatebp.org. So it's a website that includes a listing of all validated blood pressure devices in the US. And so that's a resource that I want you to take note of if you need help identifying a validated blood pressure device. And when you measure your blood pressure, make sure that the cuff actually fits your arm and that the device is easy to use. And like I said, if you can purchase or afford a Bluetooth-enabled device, it'll make it easier for you to measure your blood pressure. There's also growing appreciation that psychological health can contribute to cardiovascular disease, right? And so if you have poor psychological health, it may increase your risk for adverse cardiovascular outcomes. But if you're able to also improve your psychological health, it can help to reduce cardiovascular disease risk. So beyond diet, the American Heart Association recently stated that alternative approaches, including meditation, may actually lower your blood pressure. So on this slide, there's a study that has shown that transcendental meditation actually improves systolic blood pressure by as much as 4 points and diastolic blood pressure by as much as 2 points. And one of the findings for the study was that they observed a greater effect in older participants as well as women. And women were found to benefit more from this approach. So here are some take-home points. We know that the prevalence of hypertension in the US is high. About 1 in 2 adults have hypertension. We also know that blood pressure control rates may be declining for US adults, and this is particularly concerning. We also know that hypertension awareness is low among young adults, and we need to intervene. We also know that certain subgroups are less likely to have controlled blood pressure, including racial and ethnic minorities in the US. We also know that hypertension leads to cardiovascular disease. It also causes stroke, and it may increase your risk for vascular dementia later on in life. And like I said earlier, social determinants, so the conditions in which we live, work, and play also affect our ability to maintain a healthy blood pressure. However, lifestyle changes work. Small changes go a long way. If you're able to change your lifestyle and increase your physical activity levels, and even if you're not able to do everything at once, identifying one thing to start with and becoming proficient in that one thing would empower you to try other approaches as well. And lastly, home blood pressure monitoring is another effective approach for you to partner with your healthcare providers to improve your blood pressure. And this last slide has a number of resources if you want to know more about hypertension and how you may control your blood pressure. The National Heart, Lung, and Blood Institute has a number of resources as shown on this slide, and the Centers for Disease Control and Prevention, the CDC, also has some information that you could benefit from. And so I'd like to thank you all for your time and attention. I'll hand over to Kelly at this point.
Thank you, Dr. Commodore-Mensah. Really wonderful, wonderful presentation. Before we get started though on the viewers' questions, we know that COVID is at the top of everyone's mind. So how has COVID-19 played a role in increasing blood pressure among adults?
Thank you. That's a very good question. In terms of the evidence that we have so far, we know that people who have underlying cardiovascular conditions or may be diagnosed with cardiovascular disease have a higher risk for severe COVID-19 illness or death. However, there isn't any data that shows that people who are diagnosed with COVID-19 subsequently develop hypertension. But the caveat is that if patients have severe COVID-19, in some patients it leads to severe inflammation, and that increases their risk for blood clots. It increases their risk for heart injury, or what we call acute myocardial injury, and it leads to other cardiovascular complications. But so far, there isn't enough evidence that shows that COVID-19 actually causes hypertension. However, there are some studies that have shown that having hypertension increases your risk for adverse outcomes or having severe COVID-19.
So would that go along the lines of when one of your markers for symptoms is stress? So obviously everyone's been under a lot of stress, being quarantined and on just having to deal with all of the outstanding issues of COVID-19. So does that play a role, the stress factor then in all of this as well for hypertension?
Yes, yes. So yes, yes, and yes. So one of the slides that I presented earlier shows that there's increased recognition that psychological health also affects your cardiovascular health.
Mhm.
So this happens because when you're stressed, think about it, you make certain choices, and some of them may not be the most heart healthy. When people are stressed, they may prefer to increase their alcohol intake. And we know that that's a risk factor for hypertension. When a person is stressed, they may choose a diet that's not heart healthy. That increases their risk for hypertension. If they are feeling stressed, they may not want to exercise. But like I said earlier, exercise actually helps to lower your stress level and your pain level. So I would say that exercise is the antidote to high stress. And I have to acknowledge that, especially during the pandemic, engaging in physical activity can be challenging,
Mhm.
right? And many people don't feel comfortable going to the gym, even if they have physical distancing. But there are things you can do at home, right? If you're watching TV, you can stand and watch TV and march in place. And you can also invest in, for instance, a ping pong table. That's one of the things I purchased recently to help me maintain my physical activity levels. So there are other things you can do to ensure that you're achieving ideal levels of physical activity. And even if you don't get to go to the gym, you can walk your pet or your dog if you have one. You could also make sure you park further away from the entrance when you drive and you go shopping. There are other things you can do, and every step counts, right? And so the physical activity recommendations highlight the importance of any level of physical activity, right? So people often feel guilty when they don't meet the recommendations of, let's say, 30 minutes a day. If you're able to achieve
Right.
15 minutes, that also helps.
Thank you. Right. Any little bit helps. So that actually brings me to our first question from our viewers, which ties right into what we were talking about. And this is from Elisa. Her question is, what can you do to specifically lower the number of your blood pressure?
Thank you. That's a good question, Elisa. So there are a number of things you can do, and they fit into two different categories. So working with your provider, you can determine the right combination. One of the things you can initiate yourself is to change your lifestyle, right? So if you want to reduce your blood pressure, you can change your diet, right? You can increase your physical activity levels. If you drink alcohol, you can limit your alcohol intake, right? And you can add physical activity to your daily routine. That will help you to reduce your blood pressure. On the medication side, if you are prescribed medications by your provider, if you adhere to the therapy, those blood pressure medications work, right? They are affordable and they are effective. And often a combination of these two approaches, right, is even more effective than taking blood pressure medications alone. And in many patients who are able to maintain a healthy lifestyle, the provider may decide, well, you've demonstrated that you're adherent to this lifestyle. And so they may even adjust their blood pressure medications if there's improvement in the blood pressure. So that's another reason why you might want to adopt a drug-free approach and also change your lifestyle.
Great. Thank you. This question is from Philip, and he wants to know what exercise and other activities can help prevent hypertension. And once again, you sort of repeat maybe what you've just mentioned and a few other things.
Yes, that's a great question, Philip. So like I said in the previous slide, so Depending on the type of physical activity that you engage in, you can lower your systolic blood pressure, the top number, by anywhere from 4 points to 8 points, right? So the more intensive the activity, the more calories you burn, right? And the greater the effect on your blood pressure. But the point I want to stress is that, like I said earlier, every step counts. So even if it's walking, right? Walking goes a long way, right, to make your heart stronger. And often we say that sitting is the new smoking. So as long as you're not sitting and you're moving, that helps to improve your blood pressure control. So even if you're unable to sign up for gym membership and go to the gym 3 or 5 times a week, there are things that you can do at home and in your community to increase your physical activity levels.
Thank you very much. Dr. Commodore-Mensah, this is from Susan. Please explain the link between elevated aldosterone and hypertension.
That's a very good question. So like I said earlier, there are different risk factors for hypertension, and we classify hypertension as primary hypertension or secondary hypertension. So when someone has primary hypertension, we're not entirely clear why they develop it. And like I said, it may be because of lifestyle. But for secondary hypertension, it may be because of some underlying condition, right, or diagnosis that increases the blood pressure levels. And so the treatment of hypertension in those instances is slightly different from what we would consider the primary hypertension. So treatment for secondary hypertension may look different if we identify the cause, right, of the elevated blood pressure. And that's certainly an example of that.
Thank you very much. This question is from Jane. Are there some medications you should avoid if you have hypertension? It's a good question.
Yeah, that's a good question. And I think it's always good to consult with your primary care provider if you're considering taking maybe any alternative medications. So the simple answer to that question would be always consult with your provider to determine what combination of medications that you can take.
Great. Thank you very much. Our next question is from Jeannie. Is there any validity to it? Oh, I think you answered this during your talk, but we'll mention it one more time. Is there any validity to an old wives' tale that a heated argument can raise your blood pressure?
Yes, that's a good question. So earlier on, I mentioned that your blood pressure level fluctuates throughout the day, right? So if you check your blood pressure now and check it in 2 minutes, the numbers won't be exactly the same. But we don't expect a drastic difference, right? But if you engage in a heated argument, temporarily your blood pressure will increase, right? But hopefully when the stressor goes away, or the person who's giving you stress goes away, your blood pressure should go back to normal, right? But that's not what we consider hypertension or high blood pressure, right? And like I said earlier, blood pressure levels fluctuate throughout the day, and that's perfectly normal. But if it remains elevated over time, right, and it's consistently elevated, and if your provider checks your blood pressure on 2 or more occasions, and it's greater than or equal to 130/80, they may diagnose you with hypertension.
Sure. Well, that makes sense. Everybody's blood pressure goes up, right?
Yes.
Which actually leads into Maria's question, saying, please explain white coat hypertension.
That's a great question, Maria. So earlier I mentioned that home blood pressure monitoring is one of the ways that you can partner with your healthcare team to improve your blood pressure. So the hypertension guidelines state that home blood pressure monitoring should be used in combination with office-based blood pressure monitoring in order to diagnose hypertension. And this is because in some patients, their blood pressure may be normal at home, but when they're in the doctor's office or the care provider's office, it may be elevated. And that's what we call white coat hypertension. So their blood pressure is elevated because they are anxious, right?
Right.
But if you have a blood pressure monitor at home and you have a log of your blood pressure readings and can demonstrate that they've been normal, if your blood pressure is elevated in the clinical context, your provider can look at the numbers and determine that indeed this is a case of white coat hypertension.
So Dr. Commodore-Mensah, which blood pressure number is more important when you're doing the blood, the systolic, or which one is more important? Or are they both?
They're both important. And so in terms of the diagnosis of hypertension, like I said, if for normal blood pressure, your systolic blood pressure has to be less than 120 and your diastolic blood pressure has to be less than 80. So even if your bottom number, the diastolic blood pressure, is the only number that's elevated, you would still be considered to have hypertension. If your systolic blood pressure was 120 and your diastolic was 90, you would be considered as having hypertension. Both
Mhm.
numbers matter. However, a lot of studies have shown that the systolic blood pressure is actually associated with a higher risk for cardiovascular events. But the simple answer is both matter and are used to diagnose hypertension.
Sure. Great. Thank you. Dr. Commodore-Mensah, this is from Haley. She would like to know, what is hypotension and orthostatic hypertension?
Orthostatic hypotension.
What is hypotension, first
Mhm.
one, and orthostatic hypertension?
Okay. So hypotension is the extreme opposite of hypertension. So that's when your blood pressure is low. And
Mhm.
so one of the concerns in older adults is that if we treat them, if they treat it too aggressively with blood pressure medications, it may lead to hypotension, which
Mhm.
is a lower blood pressure. But the other question was about orthostatic, and I think they meant hypotension. So that's when you change your body position, right, your blood pressure drops suddenly, right? And patients who may experience this, it may lead to falls. And this is often a concern in older adults because we're concerned about injury if they do experience hypotension or orthostatic hypotension, which is associated with changes in the blood pressure if you go from, let's say, a sitting position to a standing position and your blood pressure drops suddenly.
Mhm. Which I think a lot of people, that happens to a lot of people.
Right.
So thank you for that. The next question is from Allison. So this is, what is preeclampsia and what causes it?
That's a very good question. So preeclampsia, we know that in some women when they are pregnant, they experience a number of symptoms. So one of them is severely elevated blood pressure. And
Mhm.
it's not clear exactly what causes it and why often African American women or Black women
Mhm.
tend to develop preeclampsia. And that poses a risk to the mother as well as the unborn child, right? But like I said earlier, we know that chronic hypertension has increased in terms of women and during the pregnancy period in the last 40 years. So the prevalence has increased about 13-fold. And we know what the causes of hypertension are, but it's not entirely clear why some women develop preeclampsia and some don't.
I see. So would heredity have something to do with it? Genetics?
It's not entirely clear if a
Mhm.
family history plays a role in the development of preeclampsia. The more plausible factors may be dietary behaviors or
Mhm.
physical activity levels or overweight or obesity.
Mhm.
Those are the more plausible risk factors for developing preeclampsia, but that's not entirely clear in terms of which factors increase the risk for preeclampsia.
Interesting. Thank you. Dr. Commodore-Mensah, this is from Ellen. Why is heart disease rising among younger women?
That's another good question. So it's not entirely clear why progress is lagging in terms of younger women. We know that in addition to the COVID-19 pandemic, obesity is another epidemic that we're dealing with. Right? The prevalence of overweight or obesity in the US is very high. It's also high in children, right? So that's actually concerning because if a child is obese as they grow older, it increases their risk for hypertension, it increases their risk for heart disease. So I think if we were to track increases in overweight or obesity prevalence, we might see that there's a strong association in terms of why we're seeing higher rates of heart disease in younger women.
Interesting. Very interesting. So thank you very much for that. So this is a question from Jenny. If your blood pressure fluctuates frequently, what medications may be recommended?
So it depends on how much your blood pressure fluctuates. So if your systolic blood pressure goes from 120 to 122, that's not really considered a fluctuation. But if it goes from 120 to 140, based on your home blood pressure readings, your provider may perform a number of tests, right? They may send you home with a blood pressure monitor to really study or understand the fluctuation in your blood pressure. And then they may prescribe therapy based on what they find, right? So the first step is to actually diagnose the condition and determine if the fluctuations are really severe. And once you understand if indeed there are fluctuations in blood pressure and extreme fluctuations, your primary care provider will actually decide what therapy you need to treat your hypertension.
Great. Thank you. Dr. Commodore-Mensah, this is from Linda. What amount of sodium is recommended?
Thank you, Linda. So ideally, we're supposed to consume less than 1,500 milligrams of sodium a day. But as you can imagine, the average American consumes somewhere around 3,000 milligrams a day. And many people do not realize the amount of sodium in the foods that they consume. So most people struggle with adhering to that recommendation, but the recommendation is to consume less than 1,500 milligrams a day.
Oh, thank you. Dr. Commodore-Mensah, this is from Michelle. Once you begin a hypertension medication, are you likely to be on it for life?
That's another good question. And so in patients who are prescribed hypertension medications, the providers often evaluate their blood pressure levels to see if they're responding, right? If your blood pressure is lowered because you're adherent and taking your blood pressure medications regularly, and if you're able to change your lifestyle, I think I mentioned earlier that the provider may lower the dose. In some patients, they've been able to successfully change their lifestyle and make radical changes to their diet and increase their physical activity levels. And some patients have had their medication adjusted to a point where the dosage is really, really low. And some have had their medications discontinued. But the thing about hypertension is that once you're diagnosed with it, you have this condition for life. It's never considered cured, right? Although there may be instances of people who've had their blood pressure medications significantly reduced, often people who are diagnosed with hypertension and start taking treatment end up taking it for the rest of their life, even if they end up reducing the amount they take.
Right. So basically, you just need to be on a good program and manage this.
Exactly.
Right.
Right.
So thank you for that. The next question from Anne is, if I had lymph nodes removed, should blood pressure be taken in the other arm?
Yes. So, and that's one of the things that when you're having your blood pressure measured, you also have to inform the person who's measuring your blood pressure to not take it in that arm. And often the technician or the provider will be aware of your medical history and know not to use that arm. But as the patient, you have to be your own advocate and make sure that it's always taken in the right arm. So do make an effort to educate people and make them aware because they may not remember where the lymph nodes were removed.
Excellent. Great. Thank you very much. The next question, Dr. Commodore-Mensah, is from John, and he'd like to know, what is vascular dementia?
That's a great question, John. So there are different types of dementia. So Alzheimer's is one of the most common types of dementia, but vascular dementia is the one that's caused by hypertension, right? And so any vascular, when there are changes in your blood vessels, right, they change throughout your body. So if you have hypertension and you increase the force in your blood vessels and your arteries, it affects different organs. And so, like I said, hypertension is also linked to brain health, right? So if there's any damage in your blood vessels that lead to your brain, right, that could cause dementia that involves the blood vessels in your brain, which is vascular dementia.
Right. Thank you. This next question is from Kathy. Why were blood pressure guidelines lowered? Question number one. And does this account for the increase in hypertension?
That's a great question. So the blood pressure cutoffs were lowered because of evidence from the SPRINT trial. So the SPRINT trial is a randomized controlled trial that has shown that people who had their blood pressure lowered to less than 120 over 80 had a much lower risk for cardiovascular disease. So data from the SPRINT trial supported the lowering of the blood pressure cutoffs from 140 to 130, 140 over 90 to 130 over 80. So yes, that also accounts for the higher prevalence of hypertension, the 47.3 that I referred to earlier. So using the new cutoff, about 1 in 2 Americans have hypertension. But if we use the old guidelines, the 2003 guidelines, 1 in 3 Americans would be considered as having hypertension. So it's still a problem. And in terms of blood pressure, the lower it is, the better. And as long as it's less than 120 over 80, it significantly reduces your risk for heart attack, strokes, kidney failure or kidney disease, and dementia later on in life.
Thank you very much. Dr. Commodore-Mensah, this is from Anne. Why can blood pressure be 30 points difference between your arms?
Why can blood pressure be 30 points different between your arms? I'm not aware of that wide range in blood pressure. It could change. It depends on the person's body or what's going on in terms of their physiology. But I'm not aware of that drastic difference in terms of the arm that it's measured. But in terms of blood pressure measurement, we know that there are a number of factors that affect the result, right? So correct positioning. So there are a number of steps you have to take when you're measuring your blood pressure, right? So the arm has to be at the level of the heart. So if you measure it accurately in one arm and inaccurately in another arm, that may contribute to what the difference that you may observe. But like I said, blood pressure is fluctuates and it may differ from one arm to the next. And so if there are concerns about that drastic difference, a provider or a technician may measure your blood pressure several times, right? Just to confirm what your baseline blood pressure is.
Great. And if you're using a blood pressure cuff, should you do it directly on your arm, like not over your
Exactly.
sweater or your any type of blouse or anything like that, correct? Just
exactly.
against
So
your skin.
Yeah. With
Mhm.
blood pressure measurement, like I said, correct positioning determines the accuracy of the blood pressure values. Another factor is that you want to make sure you're using the right cuff size. So if you're wearing a sweater and you try to measure your blood pressure, right,
Mhm.
your blood pressure reading may not be accurate, right? If you use a cuff size that's too large, it may artificially lower your blood pressure. If you use a cuff that is too small, it may artificially increase your blood pressure. So it's important to use the right cuff size. And if you have thick clothing, that may have the same effect, right? And,
Right.
and lead to an accurate blood pressure reading.
Excellent. Thank you. So question from Anne, is there a relationship between hypertension and decreased or elevated pulse rate?
A relationship between hypertension and increased or decreased pulse rate.
Mhm.
So I'm not aware of that link, right? So when your blood pressure increases, your heart rate may also increase, right? So it depends on the reasons why your blood pressure increases, but it's almost unlikely for your blood pressure to be severely elevated and your pulse rate to be um, low. And it also depends on what's going on. Are you bleeding? Do you have a health crisis that needs to be attended to?
Right. Thank you. Next question is from Deborah. She wants to know, what is the best time of day to take your hypertension medication? And is there one?
I didn't know that there is a particular time that is ideal, but your provider will tell you how often to take your blood pressure medication. So if it's prescribed for twice a day, you would often take it in the morning and in the evening. If
Mhm.
it's prescribed once a day, it's important to identify the time of day that works best for you and it's easier for you to remember. If it's easier for you to remember it first thing in the morning, then do that. I think what matters is that you take the medication because drugs only work in people who take them. And so, unless your provider has prescribed a different frequency, I think you have a little flexibility in terms of when you decide to take your blood pressure medicines
Yeah, I would think that probably taking it at the same time every day, one, to
consistently.
remember doing
Right.
that, yeah.
Yes,
And two, it gives
exactly.
your body your 24 hours in between doses.
Exactly.
And so Gail would like to know, how does blood pressure medicine actually work?
How does blood pressure medicine actually work?
Mhm.
Okay, so in one of the previous slides, I shared that the number of ways that blood pressure medicines work. One of them is to relax your blood vessels, right? Another is to remove excess fluid. So if you're taking Lasix or what patients often refer to as the water pill, it helps to remove excess fluids from your body, and that helps to bring your blood pressure down. And another class of medications also helps your heart to beat more effectively and work better as a pump to help lower your blood pressure.
Okay, great. Dr. Commodore-Mensah, we have just a couple of minutes left, but perhaps you could address the relationship between hypertension and Black and Brown communities. I know you touched briefly upon it during your talk, but if you could just expand on it a little bit.
Yes, I'm happy to do that. So, in one of the previous slides, I showed that the prevalence of hypertension is much higher in African Americans or Blacks in the US, in men and women who are Black or African American. We also know that Hispanics in the US
Mhm.
also have a growing prevalence of high blood pressure. But one of the concerning things is that awareness is also low in Black and Brown communities. And so that points to the issue that we need to do better in terms of our public health response to ensure that we are reaching underserved communities to increase awareness, right? So health literacy is important. People need to understand the causes of hypertension, how you can treat hypertension and control hypertension. And some patients, language may be a barrier. So in our public health efforts, we need to ensure that We are reaching people where they are. We are reaching people in the community. And so there are a number of community-based strategies to increase awareness, to improve blood pressure control. So healthcare providers and clinicians can partner with community-based organizations and religious institutions to make people aware that hypertension indeed is a leading risk factor for heart disease, and especially young women. As I mentioned earlier, we are not doing a good job of increasing awareness in young women, and young women need to know that although they are young, having hypertension can increase their risk for adverse outcomes later on in life.
That's terrific. Well, it looks like we're running out of time, and I would really love to thank you, Dr. Commodore-Mensah, and all of you for joining us this evening. And Dr. Commodore-Mensah has graciously agreed to try to respond to any unanswered questions we may have asked this evening. And you will also find relevant articles available on our website. In a couple of weeks, you'll receive an email with her responses. If you've enjoyed tonight's discussion, please check out our website, hopkinsmedicine.org/A Women's Journey, to watch for announcements about future conversations, podcasts, and special programs brought to you by A Women's Journey. In the meantime, we hope you find our monthly emails informative and engaging. Conversations That Matter is brought to you in part through a non-restrictive educational grant from Bristol Myers Squibb. Good night and stay well. Thank you.
Thank you.